Shannelle Campbell, assistant professor at UNC Hospital's Hillsborough Campus, general surgeon. I became a doctor because I was very interested in wanting to help people. I have always been very interested by the sciences, and being a physician was a very good way of combining those interests along with the ability to really help people at some of their moments of greatest need. That was the primary driver. I chose general surgery because I really liked the breadth of disease processes that general surgeons take care of. The general surgeons that I was exposed to when I was in training were dedicated, driven, and they always seemed to be having such a good time taking care of people, taking good care of people. And that has always stuck with me. And also the ability to be able to form long-lasting relationships with people also very much appeals to me, and I found that to be most true most of the time in the general surgery world. I chose to enter private practice initially in large part because I felt like it was time to go home to my home state of South Carolina, and was in practice there for several years, and it was a tremendous experience on so many levels. I had spent my entire medical life in very, very large academic, very prominent medical centers and medical schools, and that was the only world I'd ever known. And that world is a very important world, but what I sort of term the world of the boots on the ground docs who, are doing the work day in and day out. Until you are out in the community, living in that community and taking care of the people in that community, you don't really realize what the impact is of what you're doing. People really appreciate doctors who take their time and want to do a good job for them, in their community. And I chose to come back to the University of North Carolina because it was also time to come home. I did my residency training here and learned a fantastic amount, and a lot of the same people and surgeons who trained me are still here, and that speaks volumes about who the university is and about the strength of the Department of Surgery. What I want patients to know about me is that I will absolutely take the time to listen to what it is that you're saying and to be your advocate and your teammate, that we're going to work together to get you better.